Welcome to The Point, a podcast by Apex Benefits and dedicated to employee benefits thought leadership. You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.
Welcome back to The Point. This is Scott Long, Executive Advisor with Apex Benefits, and on today's episode, I am joined by Jeff Dorfman, Director of Sales from HealthJoy. Jeff, welcome to The Point.
Thank you for having me. I appreciate it.
Absolutely. Hey, before we dive into conversation, maybe for the benefit of our listeners that haven't come across HealthJoy, could you help just share, what you do, a little background about HealthJoy?
Sure. So the reason HealthJoy was created was to give employees a better experience when it comes to their benefits. And by giving them a better experience, also improves, one, consumerism, so employees will make better choices. It makes it easier for employees to communicate with their employer and also vice versa when it comes to their benefits. And finally, I would say it gives them a one-stop shop. And then from the employer side, it helps them communicate with the employees in a way that may steer them towards company initiatives, but also is just a great tool to say, hey, we're there and we care about you. So again, we're looking to improve the entire experience.
Thank you. Thanks for the background, and you're right. That's now more than ever, employers are really trying to help help their employees understand what they're doing for them, and in the very point you made, that they care, and that's really. As I mentioned before we got on today, the very reason I wanted to devote time to this particular conversation is that, over the last 60-ish days, and really going forward for at least, I'd say, the next 60 to 90 days, where we're at here at the end of May, beginning of June, you've got HR teams, leaders that are communicating with their employees that are working remotely, right? And so the HR personnel, they're actually remote, sometimes for the first time, but they've got just a lot of employees that are working remotely where they weren't before. And sometimes, from what conversations that I've had, employees are working remotely for the first time, not just for the first time with their particular company, but ever, right? They just don't have that experience. And so I think it has brought upon new complexities that HR teams really are wrestling with. And, I think what I've heard is, HR, that they're searching for ways to keep their employees motivated. They're searching for ways to keep them engaged, but on the other side, methods of communication. I talk to employers, clients, prospective clients, folks that I know in the business community that don't have anything at their disposal beyond traditional methods of communication, like email, right? Phone and email. And so it has, from what I can tell, brought upon a new set of challenges. And so, something that I definitely wanted to get, Jeff, your insight on, because you've got to be talking to as many employers as I am, in terms of communication methods that employers that you're hearing about using to connect with their employees, what's the range that you see for that? On one end of the spectrum, you've got this app-based approach, which is dynamic, and on the other end of the spectrum, you've got email, which is static for sure. what's the range that you see?
So I speak with companies all across the country, and it's very interesting that, and you kind of touched on it, that most of them struggle with it, because it's not just all across the country, it's also every industry you could think of under the sun.
Yep.
So obviously, many meetings that stem from HR beyond open enrollment are often because someone came to them and there was an issue, and they thought, wow, this might be a great topic to have. So it's almost like instead of being proactive, they're being reactive. So I just want to start with that. It's very common. We are seeing many meetings that are go-to meetings or virtual meetings. The one issue I would say with that, Scott, is that it's very easy for an employee to be distracted and check their email while it's going on, or even check their phone. And so I don't know if you're always reaching those people, or the kid is screaming in the background today, or the dog is barking, and there's many things that get in the way with that. Many employers are using their intranet as a source for information, or even their Ben admin system. But again, when you talk to people in the HR role, they're assuming that employees are going to those systems on a regular basis. And the fact is that they're not. So I'm only going there when I need to find something. That's usually after I might be contacting HR, where should I go to find this?
Right.
So we haven't found that to be overly successful, but that is definitely what we have seen. Other companies are using internal messaging systems such as Slack, if you're familiar with that.
Sure am. Yep.
That can be a great place to store information. The one thing I'll say about it, though, it's very similar to what you had mentioned in email, is where there are many different channels to it and there's many different messages. And the problem with that, just with email, is that it could get lost in the shuffle. You may not remember where to find it. But that's definitely a very good place to send information. And then there are that are definitely using text messaging. And studies show that that is the most effective way, or some type of push notification. And the reason is it's always on your phone. And the fact is that we have our phones with us at all times. The downside to it is that, one, creating systems to actually send those messages can be very expensive. And if they're not using a type of system for that, it's very time consuming.
Mm-hmm. Yeah, it's you've posed and shared a variety of challenges that have that have been around pre-COVID. It's the classic access to information. Where is it stored, and how do I get to it? And with that, systems that aren't capable of addressing and making both of those particular aspects easy for the end user, the challenge is still there. So, with that in mind, these challenges have always been there, right? How has your particular business changed, over the last 60 days? I've got to believe, or at least think that, there's been an acceleration of interest of employers as they've searched for new tools, as they've searched for methods of communicating. I've got to believe that there's been an acceleration of interest, but help us understand, how has your business changed? Has there been an acceleration of interest in HealthJoy? As employers are kind of right in the thick of work at home. I was just talking to a friend of mine that's on the carrier side, and they're not going back to work in the office until mid-July. They're prohibited from being face to face with us as advisors. So, how has your business changed, Jeff?
So a couple ways, and just going into office, we're located in downtown Chicago, and even though Illinois will be opening up and it's a little behind other states, the fact is most employees rely on public transportation, and no one is going to pack into a train or a bus at this time, so we're not opening till September. So that's just interesting in itself.
Yep.
As far as business goes and sales, we've seen an increase of over 30% in first-time appointments since COVID-19 began. So where many companies are contracting, we're hiring.
Mm-hmm.
And so that just gives you an idea. What I can tell you from a service standpoint, and as much as we are a communication tool, really where we're rooted is placing all of an employee's benefits in one place on the app. And that has really garnered a lot of interest because, again, no longer can Scott go to his HR director and just have a face-to-face meeting. It's not easy, and now they're also facing a ton of questions. So as an example, HR is not just worried about Scott, but because many companies have had layoffs and furloughs, they're dealing with a lot of COVID-19 issues as far as, who's eligible for insurance, how is this going to work, let alone all the questions just that might happen because you have a benefits question.
Yep.
So a couple of things that have changed. One, the number one reason employees were coming to our app, other than we were communicating with them, so it was bringing them to the app, was to look for a provider or a facility. That has completely changed. Now the number one reason employees come to the app is to use TeleMed. Obviously, people are not looking to go to the doctor right now unless it's very, very serious.
Yep.
And our TeleMed utilization increased by 50%.
Okay.
Yet our provider search went down, not quite that much, but definitely went down.
Mm-hmm.
That's probably the number one reason. The other thing that we've seen is that HR has decided they've wanted to send more messages to employees. We've seen a greater increase in that as opposed to just relying on basic templates that we were sending. And sometimes it was just to remind them of a benefit or an initiative. But at the end of the day, they want to reach out and say we're there and help guide them through whatever experience they're dealing with, whether it's questions about COVID-19, which that was another aspect of our business that's changed, that we have entire sections in the app just devoted to that, or again, if it's about any type of question that they may need answered.
Yeah, and that's the real thing, and we've talked about that, you and I, that look, HealthJoy at the core, the spirit of HealthJoy is really communicating benefits, but the circumstance that we're in, it's really helping, I guess, solve multiple issues, right? And you've got a wallet system, and so let's spend a few minutes on that because I think it'd be an important and interesting thing to hear. The wallet, you've got a card that you can create on the fly, and in this case, bring within moments, right, or at least 24 hours or less, you can bring a COVID card and put it in the wallet and communicate to your entire employee base. So I guess with that in mind, what are the top 2 or 3 practical uses that employers could activate right now with the HealthJoy platform?
So some of those haven't changed. So one, by far, the number one reason employees would come to the app in general, and now we're guiding them there because of COVID, is to the benefits wallet. And what that wallet, you kind of touched on it, entails are all of the employees' cards. So it might be my card to go to the doctor or to the dentist, but beyond that, there are cards that advertise each benefit offered to an employee, and almost always there's a link built in that would take me to the app or website where that benefit would be broken out in more detail. Mm-hmm. And that's always been the most popular function. And now we have a COVID-19 card, and within that card there are different links with information about prevention. How do I get it? How do I care for myself if I have it? What should I do if I have it? And that's obviously been very popular. And what we've been able to do is send messaging that guides employees either to that card or directly to TeleMed or to our concierge team so that we can help them whether they believe they're sick or just because they have questions or concerns. So that by far is number one. Number two is that it's still a great tool to emphasize company initiatives and programs, whether it's a wellness exam or healthy living or any other type of message, or let's say you wanted to sign up for a program through work, that we would guide employees to those initiatives. And then finally is that we want to replace HR when it comes to general benefits questions that need to be answered. And that is more important now than ever. It's not that HR doesn't want to help, but as I said, they're completely bogged down. And if it's a very simple question about how does my disability insurance work, right, or how do I find my deductible information, or what are the ins and outs of this benefit, there isn't any reason that they couldn't be guided to the app and let the HealthJoy concierge team through the app help the employee.
So that's really interesting. I want to unpack a couple things there. So my experience, right, in being at home, what I found, of course, with me is I had a hell of a lot more time, right? I'm not driving from point A to point B to appointment. So I was, what I experienced in the first couple of weeks was, wow, I can squeeze a lot more into my day. And I felt like that was a matter of efficiency, right? I'm able to squeeze more in and get more out of my time. On the HR side, I'm curious from your perspective, if you guys have stats of any type, what portion of human resources days, I guess maybe even pre-COVID or during what we're experiencing now, how much of their day is devoted to answering general questions? And I think it's a really important topic because there are employers that, 100, 150 employees, and there's really one HR person in some cases. Other organizations, have a full team and so forth. But the time devoted to just answering general questions, do you have any perspective on how much time is devoted to that?
So you touch on it. It really depends on how well staffed they are. And if I could make one quick point about that, Scott, I've been working with HR professionals for 25 years, and my experience has been, in a bad economy, they're oftentimes the first people to be let go, and in a good economy, they're the last ones to be hired. And it's unbelievable to me at some of the larger employers that I've worked with how thin those departments are.
Yeah.
So a lot of it really does depend, but it could be anywhere from a couple hours a day to half of their day, depending on many different factors, what they do, what the type of employees they have, what issues are going on at that time. The other thing is they're really not good at saying no or directing them to other places. They really want to help them, and that definitely affects it as well.
Yeah, they're very much how they're wired for sure. What what I wanted to go back to is just TeleMed, right? So that's really that has been under a spotlight for sure over the last 60 days or so, and we're providing utilization reporting to our clients, and it's certainly seen a dramatic uptick. Any thoughts really, Jeff, on the future of TeleMed?
Yes. So it's going to become the new normal. That would be my number one thought. And I think the proof is in the pudding. If you just look at overall utilization rates and how they've skyrocketed, whether it's through HealthJoy or the carriers, TeleMed, or independent providers, people are not going to be interested in running to the doctor as often. The other thing we've seen, and this is more anecdotal, Scott, but the fact is that people have contacted us just because they've wanted to add TeleMed, even though it's an entire communications and navigation tool, and that's only one little aspect of it. They wanted to add for that reason. And then finally, oftentimes employers were only offering the service like HealthJoy or even TeleMed services to employees that were currently enrolled in an employee-sponsored health plan. What we are seeing is many of these employers reach out to companies like HealthJoy that want to add that service for everyone so that regardless if an employee is on the benefits or not, that they have access to TeleMed.
Mm-hmm. So help our listeners understand HealthJoy's approach to TeleMed, though, because I think there's some nuance there.
Sure. So average utilization of TeleMed across the country pre-COVID-19 was 5 to 7%. HealthJoy's was 8 to 9 times higher than that. Our approach is that is generally the best place to start, and most people don't use it because, one, they don't remember that they have it, and two, even if they do, they don't know how to access it. It kind of goes, Scott, to what you're talking about with communication, that out of sight is out of mind, and unless you can beat it in my head or remind me that it's there, I'm just not going to remember.
Yeah.
There's too many moving parts to a benefits plan, and unless I need that service at that very moment, from the day you told me being today, there's no way I'm going to remember the details of that 3 months later when I need a service.
And there's nothing, there's nothing worse than, 10 p.m., sick child, you're up at night, and then what, right? So talk to us about, the implementation, how it gets set up, how the ease of use, because I think that's what struck me.
Sure. So it's already built into the app, and it's seamless. So an employee doesn't have to remember a phone number or download an additional app. It's literally in the menu of the app, and you answer 3 quick questions, pick a pharmacy. The average wait time to talk to a medical professional is 8 minutes. The other nice part of it is that it does depend on the state, but almost in any state that you're sitting in, that the professional can also prescribe medication, and that information can also be sent back to your primary care physician. The average savings from using TeleMed versus, let's say you mentioned 10 o'clock at night, which is the perfect example. We've all been there with a sick child.
Yep.
Versus going to an immediate care emergency room minimum is $500, and that's a national average. So the savings is tremendous. And of course, beyond what you're paying as an employee, think about how that affects the plan long term. And most employers, when they think about how they can affect the general cost of their benefits, if they can make employees better consumers, and then the cost will generally come down. And TeleMed is a great way to do that. Now, beyond just it's sitting in the app with my finger, I press it and it takes me there, is that if an employee forgets for some reason that they have TeleMed, and I'm looking for a provider or facility, such as with that sick child, and I need to take him or her in at 10 o'clock at night, before we find that facility, we'll also try to redirect that employee to TeleMed. So I'm answering a couple questions, but before we'll find someone or a facility that I can go to, one last chance. Scott, did you know that you can talk to a doctor for free? It's 24/7. Would you like to do that? That's good for half of our utilization.
Wow.
So think about that. That means that half of the people who use TeleMed through HealthJoy weren't even considering it. They were going to look for a more expensive option, and yet we were able to guide them. And then finally, as I mentioned, out of sight, out of mind, push notifications, which is very similar to a text message, reminds the employee of different services and benefits that are available to them.
Yeah, it's really powerful. Jeff, we've talked a little bit about time and the value of our time. I just appreciate you, devoting time to today's conversation and coming on the point. We'll have to not let too much time pass before we do this again.
That would be terrific. I really appreciate this opportunity.
Yeah, thanks, Jeff.
You can find more episodes for free on iTunes by searching The Point or Apex Benefits. Please rate, review, and subscribe to be the first to know about what we have in store for you. To learn more about Apex Benefits, please visit our website at www.apexbg.com or find us on LinkedIn, Facebook, or Twitter. Let's get to the point together.